And good day to everyone. When we're talking about coding and billing for physician assistants in 2024, there are some new things, but we also continually have to be reminded of the old things, if you will. Things like state scope of practice, that every state defines exactly what it is that the provider as a physician assistant can do in caring for their patients. And it defines that and is referred to in all of the manuals that you look at. So first and foremost, you have to remember, just because they can do it doesn't mean they should do it. Their state scope of license needs to be validated to find out what can they do independently, etc. And understand that it can have some significant changes state to state. And so you always want to know, for the state that you're in, what is appropriate when it comes to services for our physician assistants. So as I said, I'm from Michigan. It says in our Michigan law that the practice is a subfield. In rendering healthcare, PA cannot delegate, task, or supervise. And that's our first big thing to remember. Do you have that type of restriction in your state that says that they cannot be the supervising entity for residents or for other PA students or anything like that? What's in their state scope? So for Michigan, they can't, but that doesn't mean in Iowa or Indiana that maybe they couldn't. So the rules can be different state to state. And then there was Michigan. So when we look at our CMS or Medicare rules, there is a document that came out, and this was from the Internet Only Manual, and I like to give you references so you can go find them yourself and look at them. So there's that reference. There's also this from March of 2022. And then there's also the website page that has information about all of our non-physician practitioners. And looking down specifically, there's a tab for PAs. So what exactly is an incident to service? And we're going to talk about Medicare rules here. And this is for anyone that follows Medicare rules, not just Medicare, but follows Medicare rules for incident to services. We are also talking about our Medicare Advantage plan patients. And this can create some discourse in that XYZ commercial insurance may allow certain things, but XYZ Advantage, or our Medicare product, has to follow Medicare rules and may not be able to follow that. Remember that a Medicare Advantage plan can give you more benefits than you would have under Medicare, but not less. Now, each of our Medicare administrative contractors, our MACs, have to follow CMS Medicare policies. They may have additional information on their website. Some don't, some do. Some will have documents you can download, some won't. And so you really need to go to your MAC's website and do a search for incident to and direct billing and non-physician practitioner services and see what you can find. CGS also has a fact sheet on their incident to, and it talks about incident to is not applicable for some services. It applies only to services that don't have their own benefit category. Oh, we heard that before. Benefit categories are defined. The following services have their own benefit category and specific levels of supervision. Notice this list has more services on it than the previous list did. So CMS's criteria for an incident to services, this is as identified from WPS, my Medicare carrier, my MAC, that there has to be a professional service. It has to be performed in a non-institutional setting. What does that mean? It can't be in a facility setting. So if your practice location is outpatient department of the hospital, and those are the situations where your patients are getting two bills, then those you're not allowed to bill incident to if you're a facility biller. The place of service changes what the rules are for PA services. There has to be an employment status. In other words, everybody has to work for the same tax ID. So you cannot have your PA moonlighting on the weekends for another practice and doing appropriately documented incident to work and have the other practice bill for services unless there's an employment relationship. Now, for weekend coverage, that would be very simple to institute a contract, but they cannot work incident to someone that they do not have a working relationship with.